Well, I'm joined by Dr. Saira from Vertex Hill here at Collision Conference at the York Region booth. How's your show going for you?
Thank you. It's going on wonderful. It's awesome. Happy to be here.
Please tell us about Vertex Hill and Sadiq, one of the subsidiaries of it. It's called Sadiq, correct? Yeah.
Yes. So Vertex Health is about keeping the patients where they belong. That is their home. So we are trying to treat patients with chronic diseases, keeping them connected with the hospitals, but at the comfort of their home. So all of their vitals get transmitted to the hospital so that doctors can monitor about the health. The patients are sent reminders about their care, the special diet plans, their blood work, visit to the hospitals, so that in a way you are creating a hospital outside the hospital and keeping the patients away from overcrowded hospitals that are already there.
So you're you're freeing up resources at the hospital for patients who need that urgent care. So this is a form of telehealth, is that fair?
Not exactly telehealth. Yes, telehealth is one form of this whole system. It's more about making sure that the patients are monitored through the devices as well. So it's like real-time data transmission to the hospitals. At the same time, the doctor can advise through telehealth. So it's more of a platform which is integrated with telehealth, with pharmacy, with the lab work, with patient monitoring teams who can come to the patient's home and treat them.
Thank you for the clarification. So telehealth or a virtual visit with a physician is only one element. There's also a device that measures and monitors your physical health, as well as a pharmaceutical element, right? And as you said, blood work and things like that, lab work.
Yeah, exactly. So it's the whole continuum of the care which is provided outside the hospital. Yeah.
And is this not available through regular platforms or channels in Canada? What makes this unique?
So basically, what makes it unique is the connection with the hospital. So we are not just a virtual care provider. We call it a hybrid care platform. And we cannot take out the physical elements from the care system because it has to be there. So our data, which is the connecting point between the virtual care and the physical care, is transmitted in an HL7 interoperable form, which is like the data which can be read by the physical hospitals, and it's secure. So the secure data connection between the hospitals and the virtual care platform is the connection point. So it's whether you are at home, whether you're at hospital, you'll always have your history with you. That's important.
Speaking of connections, what's your connection to York Region with the organization?
So York Region was a region who welcomed us first because we are an international company who wanted to start business in Canada. And Richmond Hill, the government of Richmond Hill welcomed us. They supported us in incorporating our business. They provided us support in terms of the legalities of the healthcare system because healthcare is being a very sensitive area. So they connected us with the lawyers, they connected us with the business consultants. They supported us even in setting up our office. They even took me around to see what the accommodation I wanted to have. So I think the connection is very deep. It's like deep rooted in my heart, not only in terms of my business connections, but also my personal connection. So York Region has been very welcoming to us and supportive in all possible ways.
Dr. Saira, are you a practicing physician or is this your full-time thing?
So I used to practice about 20 years back, but now it's a full-time thing because I believe that treating patients as a whole, at the population health level, is much better than treating one patient.
Much more rewarding, no doubt.
Much more rewarding as well, much more rewarding.
Finally, where can our viewers learn more about your organization?
Sorry, can you come again?
Sorry, where can our viewers learn more about your company?
So the viewers can go to the website, so it's www.vertexhealth.io. They can reach out to our office through our UN number, which is on the website, or they can simply contact me from my email.
Okay, so vertexhill.io is the best place. All right, thank you so much for your time.
Thank you. It's a pleasure to be here.
Great.